When you talk about shoulder replacement, you're really talking about two different options. There's one which is considered the anatomic shoulder replacement, or what many people would consider a regular shoulder replacement. And then there's what's called the reverse shoulder replacement, which you hear a lot about now. It is newer. It's not necessarily better, it's just different. So in front of me here, I have both models. This is the regular, or the more anatomic shoulder replacement, in which case you can see the ball stays where it typically is, on the humerus. And so there's a metallic ball attached to a stem that goes down the inside the humerus. And there are different versions of these, different lengths. Some of them are stemless, but they're all the same in terms of having a ball on the humeral head, or on the humerus bone. The other component of this is the plastic piece, which goes on the socket or the cup. And it's really shallow. And so they meet together like this, but it's very dependent on your rotator cuff to hold these two pieces together. And so if you have a shoulder that doesn't have a rotator cuff, or perhaps even a shoulder that for some reason is deficient in this bone to where it's hard to put this plastic piece in, you can't do this operation and make it work. The pieces actually slide around, and they'll migrate in this fashion, and it's problematic and it won't function well. So in that case, we typically will talk about reverse shoulder replacement. And again, the reverse is newer, so it gets a lot of talk on websites, a lot of talk amongst family and friends. But it's, again, not necessarily any better than the other option. It is just newer and different. So this is a reverse. And you can tell it's reversed by, hence the name. The ball is now obviously on the scapula or shoulder blade side. And we've now put the shell on the humerus side. And it's a little bit deeper socket that you can't do with the components in the other orientation. So they now fit together with the ball mating into a little bit deeper or more constrained, as we call it, socket. And so this is not reliant on your rotator cuff to hold together. Now, one of the risks of surgery, of course, is these two can actually come apart and they can dislocate, which is fortunately very rare. But it's not requiring a rotator cuff to power or to move the shoulder. So these can rotate and move with variable amounts of rotator cuff. Of course, the more rotator cuff you have left, or the more that we can repair, the better that the function will be. And in some cases, we may even use this option if you have an intact rotator cuff, in cases when there's been a fracture, or there's some trauma which has created some other deformity in the shoulder, or again in cases where the scapula bone is deficient, because this fixates to the bone with a combination of screws, and so we can deal with bone loss issues a little bit more robustly and easily with this type of implant. So whenever we go in to do these operations, they're both done through the same incision. And so they're both available at the time of surgery. Anytime we're doing a regular or anatomic shoulder replacement, we always have this option as a backup. So the incision is the same, the approach, the whole surgery is essentially the same up until which components we put in at the very end. Your time in a sling is the same, and your recovery is honestly very much the same. So these are both of the options, and whenever we have that conversation in the office, we can talk about which one we think is right for you.